So they're found in every cell of our body, essentially. But not every cell has the same amount of mitochondria. So it's the high metabolically demanding organ systems of our body, our cardiovascular system, our musculoskeletal system, our brain nervous system. Our brain nervous system uses up about 20% of the ATP, the adenosine triphosphate that our mitochondria produce at any given moment. So just you and I having this conversation is requiring a tremendous amount of ATP to be produced within our brain and nervous system just to communicate.
Hello, everybody. Welcome to this episode of the One Thing podcast, where we cut through the noise to find out what actually matters, so you walk away with at least one thing you can use towards bettering your health. In this week's episode, we speak with Dr. Kurt Woeller about the organic acid test and its application towards helping mitochondrial dysfunction in conditions like autism spectrum disorders. We also go into further testing and other applications to help with this condition. Let's jump in.
Kurt, welcome to the One Thing podcast. Thanks for being here today.
Adam, thanks so much. It's a pleasure to be here.
Over the years on this podcast, I've come back to mitochondria again and again, not because it's trendy, but because it keeps showing up at the center of the most difficult cases I see, particularly children with regressive autism, kids who are developing typically, and then as Dr. Woeller describes, the lights went out, the children who seemed to be fine and then wasn't. Today's conversation with Dr. Kurt Woeller is one I've generally been looking forward to. Dr. Woeller is the Chief Medical Officer of Mosaic Diagnostics and one of the most experienced clinicians working at the intersections of autism, mitochondrial dysfunction, and the organic acid test. We're going to go deep into the biochemistry, the testing, and what it actually means in practice. Stay with us.
Yeah, it's so great, and I've followed your work for a long time, and I'm just excited to talk with you. I've always wanted to have a conversation with you, so it's a great moment for me. I think the interesting thing for me and our listeners is to hear where you're at right now with your work and what you're focused on, and tie that into when you were first introduced to functional medicine, and specifically some of the work you do with biochemistry and looking under the hood.
Right. Well, and I know we're going to talk a lot about mitochondria, but currently where I am, I'm the chief medical officer for Mosaic Diagnostics, and I've been in that role since the fourth quarter of 2025. And that's been an interesting role to be in, being able to kind of look, sort of behind the scenes with regards to a lab and lab testing. But I've been associated with Mosaic Diagnostics and going back to the days when it was Great Plains Laboratory, almost back to the beginning of my career. And specifically with regards to the organic acids test, which is what a lot of people know me for. I developed their 1-day intensive seminar. We took that around the country for 10 years, went to many countries around the world, and taught practitioners how to utilize and incorporate the organic acid test into practice. And that work still continues. A component of the organic acid test is understanding mitochondrial function, so we can get into that. So it's been an interesting journey. I've been involved in the autism community really from the beginning of my career. So I graduated medical school in 95, did a postgraduate training till 96, had an opportunity of moving back to San Diego, which is where I was from, to join a practice of an individual who was really more in line of what's called traditional osteopathy. So it's was kind of what I was trained on really during osteopathic medical school. But he was also very much into nutrition, alternative kinds of testing. It's where I got exposed to things like standard process and biotics and the Western Price Foundation. So after about a year, there was a conference in San Diego called Defeat Autism Now. And I had only heard of autism from the movie Rain Man back in my undergraduate years. Went to that, was completely overwhelmed, by all the information, but I recognize what these many of these practitioners and scientists were talking about with regards to what's happening with these autistic children. I was seeing in other types of patients, gut problems, behavioral issues, just chronic illness.
What strikes me about Dr. Waller's origin story is how much it mirrors what I hear from so many practitioners in this space. It wasn't a textbook that changed the direction of their practice. It was a room full of parents describing what they were living with. The gut brain connection in autism isn't a fringe idea anymore. A 2024 review by Hong and Margulis makes the case that GI dysfunction in ASD shares biological mechanisms with the neurological features themselves. It's not just a side story.
And so shortly after that, I ordered an organic acids test from Great Plains Laboratory, had a conversation with Dr. Bill Shaw, who developed that test. And that was really my start in the autism world, and that's continued to today. What's interesting though, Adam, is around that same time in San Diego was actually a hub for functional medicine. It is still today, but it wasn't being called that back then. So I had an opportunity. I went to another conference, met a fellow by the name of Bill Timmons. Bill Timmons was a naturopathic doctor, brilliant guy. And that's where I learned about salivary testing for hormones, adrenal function, gut testing, parasites, and that sort of kind of took me off in another direction. And eventually I was able to merge all of that information together into more of a kind of a cohesive, functional, integrative medicine understanding. I also had some other insights because my wife is also a naturopathic physician, such as yourself. So the people I hung out with, the people I talked to, many of the doctors I collaborated with were naturopaths. So, and then taking that back to my traditional osteopathic roots, I felt like really from the beginning, I've always been a functional, we call it whatever you call it, functional, call it personalized medicine, call it integrative medicine. That's been my existence as part of my career for the past nearly 30 years. So, yeah, it's been an interesting journey for sure.
That's very interesting. And, I think it's uh, attending a conference like Defeat Autism Now, where you're hearing various stories from not only clinicians, but also parents. It's quite eye opening. When you left that particular conference in the beginning, were you more excited or more skeptical in the beginning?
Oh, I was more excited because I was already seeing that first conference, I was overwhelmed. I mean,
Yeah.
just the weight of it all. Subsequent conferences were just as heavy in content, but it was also very encouraging because I was seeing many children that were manifesting with regressive autism, where they had neurotypical development up to a certain age, year and a half, 2 years, for example. So what I was listening to and these parents were describing is what I was seeing in my practice. So I wasn't discouraged. If anything, I was just discouraged that so much of the regular conventional medical system wasn't recognizing it. I shouldn't say they weren't seeing it. They couldn't recognize what the underlying problems or were happening with these kids. And by and large, Adam, still today, the conventional medical world really does not know what to do with all of the comorbid conditions that are seen
Right.
in autism. And I really want to use the word autism because to me it's what we're really getting at is the profoundly autistic. And these are typically regressive children who had neurotypical development, not all of them. Some of them have, problems early on but they don't develop typically. But these are the children that are often severely compromised. And that could be severely compromised with regards to their language, their behavior, their inability to socialize. They have a lot of comorbid problems, meaning they have a lot of allergies. They can have immune system problems. They can have headaches. Many of them have seizures. And the vast majority of them have gut problems, which are quite profound. So, and it all contributes to their autistic condition. And by
Yeah.
and large, although we're not able to test every single person, although I do a lot of testing in my practice, It's really well known that autistic individuals often have significant mitochondrial dysfunction.
Yeah. I want to pause here because this is a point I spent a lot of time in my practice focusing on. The mitochondria autism connection runs deeper than energy production alone. When I've looked at this clinically and in the research, including Naviel's work framing autism as the abnormal persistence of a protective mitochondrial state, what comes through is that the mitochondria didn't necessarily fail. They responded. They shifted into a defensive mode and got stuck there. That reframe changes everything about how you approach treatment. You're not just trying to fuel a broken engine, you're trying to help the system recognize that that threat has passed. Yeah. So people have heard about mitochondria in whether it's high school biology or just hearing through various publications or announcements or literatures or Facebook posts or social posts that mitochondria is something that we should pay attention to as a underlying bottleneck in a lot of health conditions, something that's disrupted, disturbed, out of balance. And we have had other discussions on this podcast. People who have listened to this podcast have known we've talked about mitochondria quite a bit. One of the things that I wanted to do, reaching out to you, is get into the process of understanding mitochondrial imbalance from the patterns all the way through the testing and, eventually applications. But in the beginning, when, say that you didn't know that there was such a strong disruption in mitochondria in uh, patients with autism, what what would you say are some of the early symptoms that we would suspect point toward a mitochondrial dysfunction?
So it's a great question. One thing to understand about mitochondria is understand a little bit more about true mitochondrial diseases. So, or what's called disorders. So, disease or disorders, these are severe manifestations of mitochondrial problems. You can have a dysfunction that might just be induced from a number of different nutritional deficiencies where you're getting some dysfunctional activity of the mitochondria, but when you resupply the nutrients, things come back line and it starts working normally again.
This is a distinction I find myself making with patients and students constantly, and it matters a lot clinically. Mitochondrial disease is catastrophic and usually caught early, whereas mitochondrial dysfunction is what we're seeing in the functional medicine office every day. The difference isn't just severity, it's reversibility. Dysfunction often has upstream drivers we can actually address: nutrient deficiencies, toxins, infections. And that's exactly why a test like organic acids becomes so useful. It's not screening for genetic catastrophe, it's mapping the metabolic footprint of a system under pressure.
Or, if you have a lot of stress, you might get compromised mitochondrial function for a while, but it's not a disease manifestation. These mitochondrial diseases typically manifest at a very early age in children, and they can be quite devastating. You can have cardiovascular problems, musculoskeletal issues, severe weakness, neurological problems are quite prevalent. Seizure disorders, for example. Children become quite weak. A very, very severe manifestation, unfortunately, could end up leading to death, for many of these children. So, usually those disease manifestations are caught relatively early because they're so catastrophic. This is a child not able to feed. This is a child not able to grow. Maybe again, they maybe have, recurrent seizures. They're extremely weak. They're vomiting. They're getting repeat infections. So there's just a number of ways it can manifest, but typically it's caught fairly early by a pediatrician or a very astute general practitioner. And these are the kids that usually will undergo some type of genetic testing to look for, chromosomal, issues with regards to mitochondria. I actually had an interesting case of a child that was eventually diagnosed with a mitochondrial disorder that occurred after an acute infection. So he wasn't manifesting with problems prior. He's very active, but assume some type of viral infection, got, pretty sick, recovered from it. But 3 weeks later, he all of a sudden got drastically weak, vomiting, nauseous, and never gained any normal function again. And, he just continued a downward spiral. And they eventually went through every genetic test you could imagine and found out there was a specific spot within his mitochondria that was severely compromised.
Mm.
So again, pretty dramatic. When you think about, to your point, the questions you asked, think about where mitochondria are most abundant. Okay, so they're found in every cell of our body essentially, but not every cell has the same amount of mitochondria. So it's the high metabolically demanding organ systems of our body, our cardiovascular system, our musculoskeletal system, our brain nervous system. Our brain nervous system uses up about 20% of the ATP, the adenosine triphosphate that our mitochondria produce at any given moment. So just you and I having this conversation is requiring a tremendous amount of ATP to be produced within our brain and nervous system just to communicate. The immune system is another place that has a lot of demand for mitochondrial activity. So when you start to get problems in the mitochondria, you can manifest with brain and nervous system problems. That could be just an adult who's got brain fog or who's having some memory issues, to a child who's having attention problems or concentration problems or language problems. You could have an individual who's developing weakness, poor fine motor skills, gross motor skills become compromised, or just their exercise stamina becomes an issue. Digestive problems can be related to mitochondrial issues. In fact, if you look at a lot of the mitochondrial diseases, many of them have an overlap to digestive problems. Constipation issues, peristaltic problems, for example, can occur. So honestly, Adam, you have to kind of really pull the lens back and sort of recognize that mitochondria play a role in every organ system of our body. And if we're getting some deficit in those areas, it could be a gut problem. It could be constipation. It could be generalized fatigue. It could be headaches. It could be problems related to sleep. So it's almost as if we really should be thinking about mitochondria each and every time we're confronted with a clinical situation with a patient that's coming to consult with us, and not skip over it and assume that it's not. We really should incorporate it as part of our differential diagnosis.
Thanks for that great overview of where to, how to look for mitochondrial dysfunction and, seeing how that organizes with the way that which organs of the body use up the most, require the most mitochondrial output is very helpful. So I think it would be great to take one of those examples, such as perhaps maybe the GI or maybe the liver or the nervous system, whichever one you feel like it. But kind of looking at, like, in a situation like that where the mitochondria has become a bottleneck, and if we were to like zoom in and look around and see what was happening in at that situation, and we were able to get a really close up view of what the mitochondria were struggling with, what would be going on? What would be the actual dysfunction in one of those systems?
So if we take the digestive system, so we have to think of the digestive system as a system that obviously we eat food, we swallow that food, we go through the digestive process of releasing hydrochloric acid, for example, and pepsinogen that gets converted to pepsin in the gut to help with protein digestion, moves into the small intestine. We get release of the pancreatic enzymes and bile acids coming from the liver. And then that digestive stuff gets moved down through the small intestine and the large intestine. And then, of course, we're absorbing the nutrients. So think about all of those sequences require coordination of our physiology and anatomy to make that happen. So we have to have the mitochondria going to be active in every single step along the way. And we could have mitochondrial problems that are primarily manifesting within the digestive system to where that movement is going to be compromised. And that, for example, just slow peristaltic activity could be related to some kind of damaging influence or dysfunctional aspect of mitochondria in the gut. Well, the cells, right? We're going to get some passive diffusion of certain things, but a lot of times nutrients like folate, for example, needs to be actively transported across a cell membrane to be absorbed into the bloodstream or into the lymphatics to circulate throughout the body. Well, many of those transporting mechanisms, not all, but many, are dependent on ATP for their ability to function. So, and then look at the immune system. We know that the lining of the digestive tract is the first line immune defense, the production of secretory IgA, the other immune cells in the gut, the innate immune system. All of those things are in their ability to coordinate information, recognize a pathogen, recognize what's a friend, what's a foe, transfer that information off to other aspects of the immune system. Well, that all requires mitochondrial activity as well. So we can end up having a problem where if we're getting primary manifestation of mitochondrial deficit in the gut, it could very well be irritable bowel. It could be a small intestinal bacterial overgrowth type of scenario. It could just be, the inability to control a chronic infection, or it could manifest as, again, chronic constipation. It could manifest as poor absorption, or it could be a combination of those things. One thing, Adam, to keep in mind, and for the audience to keep in mind, is that when we talk about mitochondrial dysfunction in the functional integrative space, we're trying to get some sort of idea of and just the general understanding of what mitochondria do in a generalized cell. But not every cell per se will have the same level of compromised mitochondria, and certainly not every organ system as well. And you just go back to the discussion of mitochondrial diseases. There are certain mitochondrial diseases that don't necessarily manifest until adulthood, and they can be very specific to a very localized part of the body, like the eyes, for example, or the cardiovascular system. So it gets complicated, obviously, from a testing standpoint, in what's generally available to the general public. So where like I really feel strongly is where we have to be as just sort of leading edge clinicians in the functional integrative space and leading the discussion is to have a good working knowledge of what these organelles do, how they organize their information, and understand where those bottlenecks may be. And to your point, the bottlenecks. Well, if we look at it just from a general biochemistry standpoint and how food stuff, glucose, for example, or fats or proteins are broken down and how they're sequenced down to smaller units to be incorporated into the mitochondria for energy production, there's a number of different bottlenecks that occur. A common one is called pyruvate dehydrogenase complex. And that particular complex is interesting because that's what helps convert glucose to pyruvic acid. Now, pyruvic acid eventually gets converted to acetyl coenzyme A, and acetyl coenzyme A enters the Krebs cycle within the mitochondria. And it plays a big role as it gets converted through the Krebs cycle into energy, the product of energy, which is the ATP. And so that pyruvate dehydrogenase it's a bottleneck, perhaps. It can be interfered with because of nutrient deficiencies. So a lot of the B vitamins like B1, B2, B3, B5 are necessary to maintain function of pyruvate dehydrogenase.
I wanted to offer a frame of reference from my own work that I think makes this land differently. In one of my posts that I put on my Substack on rebiosis, what happens to your gut after antibiotics, I walked through how fiber feeds obligate anaerobes. They produce butyrate, and butyrate then feeds colonocyte mitochondria through aerobic beta oxidation. The colonocyte mitochondria are so oxygen hungry in this process that they create the anaerobic gradient that protects the lumen of the gut. In other words, your gut lining's mitochondria are doing architectural work. They are not just making energy, they are maintaining the physical environment that keeps your microbiome in order. When that system breaks down, the cascade, as Dr. Woeller is describing, dysbiosis, permeability, systemic inflammation is often what follows. The organic acid test gives us a way to see where on that chain the breakdown is happening.
It's regulated by other mechanisms that are kind of maintaining surveillance of the metabolic system. It could be compromised because of genetics. It could be compromised because of toxins we're exposed to. There's another bottleneck, if you will, within the Krebs cycle. So as we come through that pyruvate dehydrogenase, transfer things over into the Krebs cycle, there's a number of steps, but there's one interesting one called alpha ketoglutarate dehydrogenase. What's interesting about that is that occurs in the first half of the Krebs cycle. And if it's compromised, you can't get adequate downstream reactivity. And the whole system is dependent. If you think of a factory line where we're transferring one chemical to the next, to be able to sequence this information over into what's called the electron transport chain for ATP production. Well, it turns out that alpha ketoglutarate dehydrogenase, that enzyme complex is dependent on the same nutrients that the pyruvate dehydrogenase is dependent on. So if you get compromised activity of the pyruvate dehydrogenase, you often get compromised activity of the alpha ketoglutarate dehydrogenase action.
Mhm.
So it's just happening further down the pathways. And then it gets a little more complicated, but there's other similar enzymes that are dependent on the same nutrients. And if those get compromised, well, now you're having an inability to properly metabolize glucose. You're having an inability to properly metabolize certain amino acids. And that can also many times translate into an inability to properly utilize fats to make the ATP. So those are a couple interesting bottlenecks. And I can continue if you want, or if you have another question, just let me know. But there's a couple other interesting bottlenecks that are really important, are things that we pick up on the organic acid test from. But I'll let you respond if you'd like to, and I then can continue.
Yeah, I want to definitely push into the organic acid test. And I know those particular bottlenecks that you're discussing, you can see fairly clearly on an organic acid test.
Yeah.
So I want to talk about some of the other aspects. I want to back out just a little bit because um, I imagine people listening are thinking like, where does this fit in sequence of all the different factors we've just discussed? So, for
Okay.
example, when I was introduced to functional medicine testing, it was 2006, I believe, 2005, actually, by Dr. Laura Mishley, who now does a lot with Parkinson's disease, works through the University of Washington. She's a naturopathic doctor. And she said, with every one of these tests, start with the question, if so, then what? And it really grounded me because, like, if I'm going to order this test and it comes back with these particular analytes, then what? So I've always struggled with this question when it comes to these scenarios that we're talking about, because there's so much to know. What's going on with the gut? Is there dysbiosis? Are there nutrient deficiencies? Is there toxins? Is there metals? What's harming these mitochondria? Like, should we target or test what's harming the mitochondria, or should we prove what the mitochondria is needing and work backwards? It's always sort of a conundrum in my head. And I'm curious how you frame the organic acid test in sequence to all these other fabulous pieces of information.
Great question. And Adam, I realize I know sometimes I tend to we'll go off on a little bit of a tangent with some of the biochemistry stuff. It's because it's so interesting to me.
No, I
Um,
love that, and I want to
yeah,
keep going with that.
yeah,
I
yeah. It's a great question. And just real quickly on the bottlenecks, the generalized, not everybody has to be into the in-depth aspect of the biochemistry. I think generally you just need to understand as a practitioner that there is a number of places and things that can occur along the way where the mitochondria develop imbalances and become dysfunctional. And we don't necessarily have to know all of the sequences to just have a general idea to understand how certain tests can line up and give us insight into problems. So the organic acid test really should be called a organic acid profile because there's so many markers on it that can relate either to exposures to things environmentally, certain biochemical pathways that might be dysfunctional, and many of those have overlaps into how the mitochondria function. Now, there are certain key markers on the organic acid test that give insight into some of these bottleneck areas. So you asked a good question, right? You know, what are we looking for? Why run a test? Well, what I've often found with these tests is you will often pick up on patterns and certain markers that you wouldn't know existed until you actually ran the test. Some of them might be more meaningful than others. And the mitochondria are very vulnerable to a wide variety of toxins. That could be oxalic acid being elevated from an organic acid test from somebody eating high oxalate food over a period of time. That could be nutritional deficiencies where we're compromising some of those dehydrogenase enzyme complexes I mentioned. We know that fungus, so both candida, both just generalized yeast, or even the existence of mold and some of the compounds it produces can adversely affect the mitochondria. Clostridia bacteria, which some of the compounds that we pick up on the organic acid test can also interfere. So, I mean, the mitochondria are very sophisticated, but they're also very vulnerable to damage. Their cell membranes can become compromised by things that generate reactive oxygen species and inflammation. So they can become dysfunctional from a wide variety of things. And the testing helps to give us a viewpoint of what are some potential things that could be contributed to mitochondrial issues. We may not necessarily be able to answer every single question, but we can get pretty close with some of the testing that we do. The organic acid test is interesting because there are certain markers that show up that are related to mitochondrial activity that, although don't absolutely prove 100% a cause, but the elevation is highly suggestive of what to do next and what to think. So, for example, and this will be the last complicated biochemical bottleneck. All right. But there's a marker on the organic acid test that everybody should pay attention to. Every practitioner listening to this podcast who's run an organic acid test for Mosaic, or if this is a parent or a patient listening to look at their test, there's a marker called succinic acid that's often elevated. Not in everybody, but it's elevated a good 70% of the time.
60 to 70%. I want to sit with that number for a moment. When I was learning about code tests, I wrote that SDH, succinic acid dehydrogenase, is the only enzyme that belongs to both the Krebs cycle and the electron transport chain simultaneously. It sits exposed on the inner mitochondrial membrane, which makes it uniquely vulnerable. And the list of things that can drive succinic acid up reads like a clinical inventory of what I see every day. LPS, lipopolysaccharide from gut permeability, hypoxia, heavy metals, mold, and many more things. I've written about how intestinal damage from dysbiosis, autoimmunity, chronic infection is almost always accompanied by hypoxia at the tissue level. that same hypoxia shows up as elevated succinic on the oat test. So when Dr. Woeller says the marker opens up the investigation rather than closes it, I completely agree. It's a signal that something upstream in the gut or the environment is stressing the most exposed enzyme in the system.
Most people. That particular marker becomes elevated when a very specific area in the mitochondria are compromised, and an enzyme called succinic acid dehydrogenase. And what's important about this area is it's linked to complex 2 of the electron transport chain. So we have the Krebs cycle that lives and functions within the inner space of the mitochondria called the matrix. And it transfers chemical information over to the electron transport chain, which is embedded along the inner mitochondrial membrane. And it basically sounds kind of like what it does. It's the electron transport chain. It's transferring electrons down this protein complex chain reaction that ultimately leads to ATP production. And the succinic acid and the succinic acid dehydrogenase, almost if you will, Adam, connect the Krebs cycle to complex 2. It's the same unit. And that unit is highly vulnerable to oxidative stress, which can be generated by chemicals, that could be pesticides, that could be heavy metals, glyphosate, mycotoxins. So we have to sometimes broaden our view and start looking at other testing to help bring into the discussion what somebody might be exposed to. Yeah, there are certain nutritional deficiencies that can compromise that area too. But when that succinic acid is elevated, what I've often taught in the oat seminars I taught many years ago, and we have another one coming up um, later this year, is that when that succinic acid is high, something is causing it to be high. You need to start asking the question, what could be causing it to be elevated? And a big thing to consider is environmental exposures. So that leads us to start considering other tests as things that might be causing sort of undue stress within the mitochondria. So to me, the organic acid test gives me primary information about what I can address, as well as information that says I need to start looking elsewhere for other answers as well in other testing.
Absolutely. To me, it sounds as though it would be ideal used as a baseline and then through serial testing.
Yeah, I in my practice, it I'm always doing the organic acid test. So I've often made this comment in public, in public speeches or interviews or in the courses, is that in my view, anybody coming to your practice with any kind of chronic ailment should have an organic acid test done.
Mhm.
I mean, if you have somebody came in that just like acutely sprained their ankle, and they just need some ice and a wrap, okay, fine, you know.
It,
But if you actually started asking them questions, you probably find out like, oh, they should do an oat too. But essentially it is a primary test. And then the other tests are complementary to it. So, for example, page 1 of the organic acid test for Mosaic, that the markers on that section of the test are looking at microbial imbalances within the digestive system, fungus, bacteria, Clostridia bacteria. And sometimes what you'll see certain markers elevated that are indicating aspergillus mold exposure.
mm,
Well, that should be an automatic reflex to do a mycotox profile, because the presence of these molds we know produce mycotoxins, and the organic acid test is not a replacement for mycotoxin profile. If you're seeing other certain markers like that succinic acid, or you're seeing other mitochondrial markers elevated, you might see lactic acid elevated, for example, you should have a strong suspicion that there may be some chemical exposure. What I mean by chemical would be like pesticides or, plastics or petroleum byproducts. We could do something for Mosaic, which would be the tox detect profile or heavy metal testing. There are always things in the oat that we can act upon just based on that test. But it's to me, it's always that hub of the wheel, right? It helps to give us some primary things that we can work off right now, and then to say, I need to do some additional assessment to fill in the gaps, but we can get the ball rolling. We can start doing some things now based on this core information.
It's comparative to sort of like a primary care doctor's CBC chem panel. The O test is to the functional medicine provider or naturopathic provider. It's sort of a foundational way to look at the whole system.
Yeah, that's a great way of looking at it, and it complements so many other tests. It complements a comprehensive stool test. It complements a mycotox profile. It complements heavy metals, as I mentioned. And you could, yeah, it really is a primary test, a generalized screening test for sure.
That really helps. And you know, it's I get very excited when I get into the minutia of the organic acid test because so many of the problems and things that keep me up late at night as a practitioner, it unmasks. And that's exciting and very hopeful to have things and some clarity like that because, without you're putting together hypotheses that may or may not be right, but sort of the test helps ground those hypotheses.
Right. And by the way, Adam, you know this too, being in clinical practice. Sometimes tests like the organic acid test or others that we do, many times they can, some of the, the bulk of the test might show up being normal.
Mhm.
And I don't look at that as a problem. In fact, when we get normal tests on somebody who's developing or dealing with a chronic complex problem, it often lets us know what isn't the issue. And so we can sort of check things off our list and start looking elsewhere.
I love
So,
that. Yeah,
I mean, that's another way of looking at these tests too.
I agree. And, I often share that with patients that, some patients are looking ahead and they say, well, what if nothing comes back, that on this test that, tells us what's going on. And to me, as the years have gone on, I echo exactly what you said. It's just that actually that leads to another, that's just one layer of the onion that we now have taken out of our consideration. And usually that iteration brings more clarity. So I would agree with that. And, it's just as valuable to get a negative test as sometimes as it is a positive test. So,
Yeah.
uh, well, going into some of more minutia, I know you wanted me to, you were saying we possibly would leave it, but I'm just going to push a little bit further. So, is there a way to look at the OAT test or your mitochondrial related labs and understand what's mitochondria stress versus dysfunction? And like, how are people possibly missing the boat with their takeaways from OAT testing or even some of the other mitochondrial tests that, we're seeing pop up?
That's a great question. And when you actually had sent that, I was thinking that's challenging to know. So this is where the art of medical practice comes into play, is that what you have on the test is indicating an imbalance. But what does that imbalance mean for the clinical presentation of the person where the test came from? This is where it always has to be applied as best as possible back to the individual. What's going on with them? What symptoms are they dealing with? What kind of conditions they have? What, things they're taking, medications, stress in their life, all of those factors make a difference. How long they've been ill, those types of things. So just straight up looking at a test like this can be challenging to know for sure whether it's an acute stress condition, for example, or something more dysfunctional. Another test that I often do, and this is through my own practice, is something called a MitoSwab.
Yeah.
This comes from a lab called Religion, and I really like the test. It's different than the organic acid test, for example, in that it's looking at a buccal swab as a way of assessing activity of certain components of the mitochondria in comparison to what you would get through a muscle biopsy, for example. So, about an 84% correlation between the MitoSwab assessment of mitochondrial activity compared to a muscle biopsy.
This connects directly to something we explored in our Pans and Pandas episodes with Dr. Nancy O'Hara and autism episodes with Dr. Richard Bowles, specifically the link between mitochondrial dysfunction and immune dysregulation. In pandas, that dysregulation takes form in way of molecular mimicry, where anti-neuronal antibodies are developed targeting the basal ganglia, but that process doesn't emerge out of nowhere. What a MitoSwab test can reveal, particularly the complex 1 and complex 3 dysfunction, is the oxidative stress that lowers the threshold for that kind of immune misfiring. The electron transport chain isn't just an energy system, but it is also, for these kids with these dysfunctions, a window into the immune system.
Still, muscle biopsies are really still the gold standard for, really fine tuning, if you will, a diagnosis of a mitochondrial disease. So you can look at a mitoswab and go, okay, this person's got a mitochondrial dysfunction, but to classically diagnose them just based on that test with a disease be a bit of a stretch and generally not recommended. It should be a gateway to say, hey, we might need to do actually more confirmatory muscle biopsy testing or genetic testing. So, but again, it goes back to where's the test coming from? What's the clinical presentation of the mitoswab based on an individual's problem? So I do a lot of mitoswabs with many of the autistic kids. And what's interesting is there's patterns that have tended to emerge that I've started to pick up in having looked at many of these now. So most, not all, of course, have some dysfunction happening within the mitochondria. It's usually at complex 1 of the electron transport chain, but more commonly complex 3. And I see that, all the time. It's probably about 80, maybe 90% of the kids with autism I've seen have at least a complex 3 problem, sometimes complex 1, maybe rarely a complex 4. So the complex 3 area is compromised. The test doesn't tell us why, right? It doesn't tell us if it's a genetic problem. It doesn't tell us if it's an environmental problem. Now, when you compare it or you sort of blend that information together with the organic acid test, well, we know that the organic acid test has core markers that might be elevated related to Krebs cycle activity, but there could be a lot of other markers on the organic acid test that we know could compromise mitochondrial function: fungus, bacteria, oxalate, nutrient deficiencies. So all of those things could be contributing factors to what we're seeing on the mitoswab. One of the reasons I do the mitoswab is I want to get a deeper insight into what's happening at the electron transport chain level. We can get really good information for of the Krebs cycle activity based off the organic acid test, but it's hard to get information off the organic acid test of what's happening in the electron transport chain. The mitochondrial diseases that get diagnosed in children with these catastrophic, the manifestations of problems are generally occurring within the electron transport chain.
Mm.
And they're primarily about 30, I think it's about 30%, Adam, of all primary mitochondrial diseases in children is because of a deficit of complex 1.
Mhm.
So that's the main one. What I found on the mitoswab is complex 3 generally seems to be more dysfunctional. Why is that relevant? Why would anybody care? Well, there are some aspects and some interesting literature on the relationship of complex 3 to the immune system.
Mhm.
Complex 3 is also the place that we're transferring electrons to complex 4 for that final conversion of molecular oxygen to water for the eventual production of ATP. And it's the last area too where CoQ10, people know about CoQ10. It's part of that sequencing of moving electrons from complex 1, 2, and 3. But the other thing that's important just to understand, just from a baseline understanding of the MitoSwab, is the two main complexes of the electron transport chain that tend to leak electrons are complex 1 and complex 3. And what that means is if you've got dysfunctional problems and not being able to transfer electrons appropriately from 1, 2, 3, and 4, you're going to get an increased potential of electron leakage into the matrix. You've got a bunch of oxygen sitting there, and you're going to get a lot of free radicals and oxygen radicals being developed. And we know that that is a major contributing factor to mitochondrial dysfunction, really kind of across the board. So I've learned how to use that test as a complement to the organic acid test. In my practice, I'm always running the organic acid test, and I will do the MitoSwab as well. I don't do just the MitoSwab because I want the organic acid test information to help fill in the gaps as much as possible to be able to increase my ability to help that patient with various types of either
Yeah,
doing some additional testing or specific targeted treatments.
that's gold. I hope people really are able to extract how much value there was in what you just said. And I'm just going to rephrase it in a little way to see if that sinks in. Is what I'm hearing is complex 1 and complex 3 is a real strong, when there's issues in those steps, is a real strong issue of oxidative stress. And, we're always looking for clues to oxidative stress and uh, where where to intervene and to have rationale to intervene. And so having that really stand out gives confidence in that move. And then also, and people are always wondering, what's the impact of all the things we're trying to address on the mitochondria, from all the drivers of oxidative stress and all the effort they're putting into removing various drivers of inflammation, and to see that actually there's a visible target is extremely valuable.
Yeah.
And the,
A-
the
and Adam, to your point, when you understand, and again, you don't have to completely get into all of the nuances of all the biochemistry, and just even as a practitioner to have kind of a general overview working knowledge, when you get even to that level, you can become more specific with certain targeted treatments, for
right,
example. And that makes a big difference as opposed to just sort of like just throwing a handful of supplements in somebody, and hoping it sticks. You can become more targeted and more specific. And look, we understand that there's always another layer to clinical medicine. And what we're hoping for is that even in these preliminary steps is that we're able to kind of move the needle significantly for a lot of people to help them feel
mhm,
better. Unfortunately, just in being humans and the complex beings that we are and the toxicity of our world and all the things that we can't control, there's going to still be people who need further assessment and more work. There's always more digging to do. So it's a it's always evolving, right?
yeah,
None of us are going to ever have the answers to everything, but
yeah.
these tests are absolutely really important
If
from being able to dive deeper.
Well, with receiving these results, I imagine there's excitement from new practitioners and even patients and parents to just start matching lab results to treatments and just kick off a big, massive plan. But you and I both know that's not the answer. Um, in fact, I had one of my mentors, Dr. Paul Anderson, on here talking about cell danger response theory at some point, which I know it's not his. That's Dr. Navio, I believe, is sort of
Yeah.
who's the originator of that model. However, I think I'd love to hear from you, just briefly, why we need to be careful about that launch point and how, you know, the lab results don't mean that people have to go out and do all the things or that it's even right to do all the things it's telling them to do.
I interviewed Dr. John Kaiser. He's an MD, interesting guy. Was a doctor that was originally on the front lines of the AIDS epidemic in San Francisco back in the 80s. And one of the things he recognized was that people who tended to deteriorate quicker with HIV were those who sort of, even before they got infected, had a very, very poor lifestyle and a very poor diet. So they didn't have the resources already inherently to sort of combat any kind of infection. And he started kind of looking at some of the lifestyle factors that really, makes a difference. And we sound like a broken record when we talk about these things because it really comes down to eating a whole food, real food diet. Making sure you're getting as much nutrients from real food, getting plenty of rest and sleep and restoration, getting a consistent amount of exercise. You don't necessarily have to be an endurance athlete, but just doing these things consistently makes for a huge, huge difference. And I would say also just looking at stress. We all have stress, right? So, but ways of toning down the vagus response or improving the vagus response, I should really say, and here, toning down that sympathetic nervous system. All of that's going to be very impactful on the mitochondria. And that kind of goes to the heart to some degree of the cell danger response that Dr. Naveau talks about, kind of the inherent wisdom of our body and the cells and things at the cellular level, the way the cells and the mitochondria protect themselves. And if you push too hard, too soon, too much, there's a pushback. And that's something that's we recognize and practice all the time. And so there's to me, again, it comes down to the tests. What is it showing as far as the imbalance? And then I want to come back and say, I want to know more about the individual, because there are certain people that can handle more treatment up front, and there's some that you have to go very, very slow. The mental emotional component is huge. It's a major driver for people who have chronic complex problems. And I mean, Dr. Neil Nathan, talks a lot about this. He does a wonderful job of sort of explaining the whole mental emotional stress component of what people need to really look at and evaluate within themselves to help turn down that stress response. And I think ultimately it does help turn down the cell danger response and the allows their body to become more accepting of the nutrients that they need. Interesting, one of the things about some of the nutrients that we can use, sometimes, when you actually give somebody who's deficient in some of these B vitamins, for example, let's just go back to that bottleneck we talked about before, where that pyruvate dehydrogenase and the B vitamins is dependent on. Well, and you don't always know, Adam, you know this, right? Sometimes it's really difficult to know who might react and who might not.
Eh,
But you can start off sometimes with some of these B vitamins and it they do appropriately what they're supposed to do. They kind of turn on the engine,
Yeah.
but there are other imbalances that are happening, either environmental exposures or downstream imbalances that might be occurring in some aspects of the mitochondria, where all of a sudden the engine turns on, the system ramps up, and they're just not ready for it.
Yeah.
And you don't sometimes find that out until you actually just start trying some things. But I think the bottom line is that what do you do, or what can we do, any of us, is to go back to the fundamentals as best as possible, trying to live more in harmony with the natural rhythms of
Mhm.
nature, and that is eating a healthy whole food diet, not over consuming stimulants, getting adequate sleep, getting plenty of rest, being consistently active, being outside, getting natural sunlight, being in the natural world. It sounds, again, I think people go, "Oh, yeah, there they go again," but these are really important principles, and the the cellular rhythms of our mitochondria and our cells are linked to the universal rhythms of our planet and our universe. And so we're we come from the same source. So it doesn't always have to be a supplement.
I've been a naturopathic physician long enough to have watched this lesson arrive, get forgotten, and arrive again. And I always keep circling back to it too. Again, that rebiosis post I wrote was really about the same thing Dr. Woeller is saying here. After antibiotics strip your obligate anaerobes, you can't just take a probiotic and expect recovery. You have to rebuild the conditions, the fiber, butyrate, the oxygen gradient, the microenvironment. The biology has to find its own rhythm again. Dr. Naviel formalized this with the cell danger response. Healing cannot be completed until the choreographed stages are returned to readiness. You cannot push through that. I think about the parents I've worked with who want to do everything at once. And I think the most therapeutic thing I can offer them sometimes is a framework for patience. That's not a soft idea, that's cell biology. Exactly.
Supplements. It doesn't always have to be some fancy, expensive treatment. It's not, I'm not saying that those don't have a role, but each and every one of us can become more attuned to what our body is telling us, and listen to that inner voice about what we think we need to do for ourselves. And if you're a parent, what you think, be attuned to your child. So those, all of those things can make a tremendous difference. And I think honestly are really ultimately essential for anybody dealing with a chronic complex problem, whether it's a primary mitochondrial issue or something else.
Such a beautiful message to absorb and to reason through and to kind of just be moved by. So thank you. And I want to also add to that the parent that's home and their child has ARFID or can't make all these dietary changes, maybe even have troubles taking supplements or resistant, or it's kind of a nightmare sometimes when you're trying to implement some of these suggestions that I make for patients. It's difficult. And at the same time, doing a test might give the gateway, the baby steps of things that you can start making moves slowly that open up more of the foundational moves. So it doesn't have to always start with foundation. It can end with foundation and start with, real specific targeted steps. But
Yeah.
working with someone who knows that and knows the art of that sequence is really important. And I just want to comment on something you said before we wrap up here is, the in tune with the nature's rhythm. And I really like that because, we're talking so much about a neurologic nervous system disorder that's tied to the electricity of the body. Mitochondria is, sort of the electrical output of, uh, um, of the body. And, simple things like, just getting outside, getting away from the computers. That
Right.
doesn't require a special food preparation or to take dairy out of the diet or, take a handful of supplements, but it could be just like such a simple, accessible thing.
Yeah, I have a lot of stories, and I'm sure you do in practice, where simple things like that have made a world of difference for adults, teenagers, kids with special needs. I mean, it's really essential, and I think it often gets lost in this complicated world that we live in, with being barraged with information about this supplement, take this product for your microbiome, take this over here for your mitochondria, take this for sleep, take this for weight loss, on and on and on. And the functional integrative medicine world is being flooded with these kinds of messages too. I mean, so, I mean, Adam, as a naturopathic physician, I mean, you, your schooling was in nature medicine.
Hmm.
So, it's just that it's a big market. And it's not
Yep.
to sit there and say there's not useful information and that these things aren't helpful, but it all, all in its place and context. I'm a huge believer, not just a believer, knower that these natural rhythm therapies, whatever you want to call them, getting outside, all of that stuff is really truly important. I mean, there's some interesting research out there. I read a research article where they had done a study and looking at natural killer cell activity in people who spent time in a city environment and spent time in a forested environment. This is the
Yep.
concept of biophilia. And there was a dramatic change in just natural killer cell activity. Natural killer cells are hugely important for chronic infections, for cancer treatment or cancer surveillance, a major part of our immune system. So, yeah, those small things like that are really important, and they're generally free. I
Yep.
mean, these are the things that don't cost anything to do. One of the things I've noticed, Adam, I'm sure you have too, is that you can't you can't push healing, right? You can't force the body into a healing response. I think that ultimately was, I don't know for sure, probably something that Dr. Naveau, who came up with the cell danger response, recognized that once you get to a certain place of dysfunction and things are so out of balance from a pure cellular mitochondrial standpoint, you have to get back to the rhythm approach. And you can't just force supplements, like take more CoQ10 or take more carnosine. That's going to be the fix. Um, because it often isn't. It's not to say those things aren't essential and then they're not needed. Our biochemistry is dependent on those substances.
Mhm.
But if they're not moving the needle, there's something else going on. And we have to continue to search and look and expand our view, pull the lens back and say, what else may be happening here? And I've often found that you know, some individuals, when they're confronted with these chronic complex problems, the last thing they really want to address or and acknowledge is the mental emotional stressors in their life. So it's it's much easier to just take a $30 supplement and hope that it's the fix, as opposed to digging into sort of the deep psychological aspects of what's going on with you and everything else. So, but it's
That's
it's
true.
it's,
Yeah.
it's all part of the process.
Yeah, absolutely. I mean, and people arrive at that place at different times, right? And it might not be when they're in our office, it might be another office or another leg of their journey. So, but yeah, I completely agree with you. Um, well, this has been amazing. I think, with just hearing your passion and your understanding and your knowledge and groundedness is really helpful in these days, in this day and age. And, gives confidence to, I think, people listening, about how to use this tool and then how it fits within the larger framework. So thanks so much. With understanding that mitochondria is such a key thing to helping people with autism, it's good to have a roadmap, and you've given us a big piece of the roadmap to consider as part of the plan. So this has been great. I'd love to wrap up by hearing anything that you'd like us to know about things you're working on and ways people can follow your work.
Yeah,
Sure.
there's a lot that we're working on. So at Mosaic, as being the chief medical officer at Mosaic Diagnostics, we have we're- a, a new in-person seminar that's coming up April 30th through May 2nd, 2026 in San Diego, called the Mosaic Edge Summit. And this is going to be on the principles of how to apply in clinical practice and interpret from a foundational standpoint the organic acids test. So it's going to be a collective effort by a number of great practitioners at Mosaic to go through different components of the organic acid test, including some aspects on mitochondria. So I would encourage any practitioner out there who is interested in learning more about the organic acid test to come and, you know, come for a weekend in San Diego. For that, they can also go to Mosaic's website and learn more about it. As far as some of the other things that I'm involved in, I have a number of courses through my Integrative Medicine Academy. So integratedmedicineacademy.com. This is an online academy of different what are called mastery courses. So I've probably created over, at this point, maybe myself, about 230 hours of lecture material on various topics from autism to candida, clostridia, organic acid testing. And so those are courses that are evergreen. People can purchase them whenever they want. And for this specific topic, I actually have two courses on organic acid testing, one called the Essential Oat, the other called the Advanced Oat. And I have a very in-depth, interesting course on mitochondria called Mitochondria Mastery Course. So again, practitioners can go to that website and learn more about what we're doing there with regards to some of the mastery courses. And then if you want to follow me, I mean, I've got a lot of videos online through YouTube and whatnot, but I actually have a Substack. So
Oh,
drwoeller.substack.com. And that's a
great.
place where I post articles, I'll post videos, I might share other people's stories. And I I I use that as an area for me to do some writing. I'll break down a research article, for example. I get into the biochemistry a little bit more in depth. It just depends on my mood and how much time I have. But I've posted some pretty cool articles on Substack. It's all free, so you can go and join. People can always donate if they want, but I try to keep up with that with new content, as time goes on. So those are places that people can follow me.
Excellent.
Oh,
Well,
and then the
again,
podcast real quick. Sorry, Adam, the
yeah,
podcast. Yeah, yeah, yes,
yes,
I apologize. Yeah. So my podcast, so functional medicine doctalk.com. So we've just completed 2 seasons. I'm heading into our 3rd season. And like you, I like to have guests on where we get into some detail and we kind of get into the weeds a bit, with regards to the content. That's kind of what interests me and drives me. So functional medicine doctalk.com. We're on Spotify, Apple Music, just like you. So
yep.
we're on all the major podcast platforms.
I am a subscriber to to your podcast, and I really enjoy it. It's part of my Sunday workout.
Okay. Awesome.
um, yeah. So, well, again, thanks, and I'd love to down the road regroup with another topic if you're interested. This has been a true pleasure.
Absolutely. Yeah, be happy to come back. So thank you for the opportunity.
Thanks for tuning in to this week's episode. What Dr. Woeller gave us today is something I find myself hungry for as a clinician, a framework that connects the dots from the organic acid test as a first pass metabolic map to the MitoSwab drilling down into the electron transport chain to the cell danger response, reminding us that healing has to be earned, not forced. For those of you who are struggling with conditions like PANS, PANAS, regressive autism, or with any complex chronic condition, the takeaway is this: the mitochondria are not just an energy story, they are a story of how the body responds to threat and what it needs to feel safe enough to heal. If you want to go deeper with Dr. Woeller, find him at integrativemedicineacademy.com, on his podcast, Functional Medicine Doc Talk, and on the Substack at woeller.substack.com. And if today's episode connected with you personally, and it's something you've been seeing clinically or living personally, please share it. This conversation deserves a wider audience. Till next time, I'm Dr. Adam Rinde, and this is the One Thing Podcast.